Welcome to DermSphere, where skin meets science. I'm Dr. Bisher.
And I'm Dr. Casal. Today we're going to be talking about Molluscum Contagiosum. This is a type of pox virus in the same family as ORF, smallpox, and in the news recently, Mpox.
So Molluscum Contagiosum means that it is contagious, right? It's in the name.
Exactly.
So tell us a little bit about where this happens, who it happens to, why is it contagious, or how is it contagious?
So molluscum we see most often in kids and children, and they present with these little papules on their skin. They can be anywhere where they're touching things, so on the knees, elbows, hands, feet, neck, and they have a little umbilication to them, which is kind of characteristic of these types of pox lesions. So they're either spread by fomites, which means that the virus itself gets transferred to an object, which then another kid touches or picks up, and it gets inoculated into their skin, or it can also be transmitted sexually.
They are self-containing many of the times and will go away in about a year or so at the max. However, they can also spread because they are contagious. If they're scratched, they can spread through water. So if you have two little kids and you're bathing them in the same water, or they're at the swimming pool, you can transfer it that way as well. If you're scratching yourself, you can scratch the virus into other parts of your body. So if they're one or two lesions, sometimes you can leave them be, but they can also come around the face, the eyes, and be problematic in these areas. That's when you go to the next step of treating them. So we would say seek professional help. Don't try to treat them yourself. How do you treat them?
So one of the difficult things about molluscum is that there's no generalized consensus on how to treat these among dermatologists. When it comes to viruses, especially this virus, we don't have a good drug that works to stop the replication of the virus like we do for, let's say, herpes with like valacyclovir.
For the most part, it's not as serious as the herpes virus, because the herpes virus can, for example, cause blindness if it occurs in the eye. In herpes, there's herpes type 1 and herpes type 2. This isn't about herpes, but we're just comparing these viruses. So this virus seems to be a little less, I would say, aggressive or have more morbidity, doesn't have as much morbidity as herpes. Right. So that's probably one of the reasons, is because you're not going to spend all this time and research and money on a virus that's less aggressive or a little more benign than the herpes virus. And I'm talking about generalities. Now, molluscum can also occur in people who are immunocompromised, and you can have a ton of molluscum if you're immunocompromised, if your immune system isn't able to fight it, if you're on certain medications, if you have certain conditions, whether it's cancer or HIV or any of those conditions that lower your immune system, it's going to be harder to fight viruses in general, including molluscum. So that's why there's no one consensus. But there have been some trials and studies out there, some of them being prospective, meaning they know what they're going to study and they're going to go forward. Some of them being retrospective, meaning you look at what's already been collected and you try to make sense out of it. So let's take it away with the prospective randomized control trials. Randomized meaning you don't know which one is the treatment group and which one is the control group. That means they didn't get the treatment. Yeah. So let's talk about the randomized ones. The first one is curettage. That means you are curetting it. So a curette, it looks like this. It's like a scoop with a sharp edge, and you scoop it out. You curette it.
Yep. So we call this sometimes enucleating these lesions. They're basically taking out that core, that center. And this is the same reason why, what Dr. Bisher alluded to earlier, when you scratch or itch these, you can self-inoculate. So you can spread the virus from one place to the next, but when you curettage, you take that little core out, that's the most contagious part. So you're removing that and you're letting the skin around it heal in. Curettage has been found to be very, very effective for molluscum.
Yeah, and this is very interesting because under the microscope, you can actually see the center. You see the center and you see all the virus molecules in there. You can remove that, it's gone. That molluscum is basically dead. All right, so that's one. So manually, basically digging it out. Number one. Number two is pedophylotoxin. We don't use it much. It's just topical. You put it on and then it creates the reaction and then it gets rid of the molluscums. And then
potassium hydroxide, KOH.
Okay. KOH, 5 to 10%, right?
Yes.
That's an interesting one. Do you use that in practice?
No.
I don't really use that in practice.
I know it's been studied, but I've never used it in practice for molluscum.
And then the last one is basically vinegar, right? Trichloroacetic acid.
Yep. TCA.
So
yeah.
TCA. So again, you put this on and the acid irritates it. And then you're removing it. So those are like the top tier studies, randomized controlled trials. Others look at it retrospectively, and those are cryotherapy.
Cryotherapy. Cantharidin is another one that's really commonly used, and it usually doesn't hurt at all when it's being applied.
And that's usually for kids.
Right. Some dermatologists call this beetle juice because it's actually an extract from a beetle.
And you can destroy them with lasers, right? Like CO2. I think PDL, pulse dye laser. I don't like to use lasers with viruses because the plumes can have the virus. You can like inhale them. They can go to other parts of your body, into your eyes, all of that. I don't like using lasers on viruses. I'd wear an N95 usually when I do it. I wear a shield, but I rarely do it.
And I think one of the recurring themes of a lot of these treatments is you're irritating the skin, causing your immune system to respond to these lesions, which is then going to cause your body to mount an immune response to it and clear the virus itself.
And then there's systemic cimetidine. Basically, cimetidine is a H2 blocker, so antagonist. And that helps with acid reflux, but we use it for certain viruses like warts, and now people are using it for molluscum as well. That's taken orally, and that's also thought to help stimulate your immune response. So with that is imiquimod as well, which is a topical immunomodulator, and that's supposed to, again, stimulate your immune system to fight the virus.
Right. Cidofovir is another one. That's an antiviral medication that we use.
Yep.
So there's like decreasing levels of evidence here. Some people will even use tretinoin, which is a vitamin A derivative.
That's a good one.
Also, I've heard of dermatologists using iodine. So lugal solution, potassium iodide. Right.
So there's a lot out there. These are the retrospective studies. But in practice, when I see molluscum, I will usually freeze them if they're an adult.
Yep.
It's with liquid nitrogen, there's no particles going everywhere. Or we would do the beetles use the cantharidin. It's a blistering agent. You think blistering, could it cause scarring? So cantharidin blisters at the very top layer, so it shouldn't cause scarring. It might cause some like discoloration as you're healing, but it doesn't go deeper than the dermis, doesn't go into the dermis, deeper than the epidermis, just kind of sloughs that top layer off. So when it does that, the virus sloughs off. I also use imiquimod specifically on the face, also known as the brand name Aldera. So we use it on the face because sometimes I don't want to freeze on the face or blister the face. Lastly, when we treat it, we usually don't see, unless again you're immunocompromised, we don't see it come back in people. It's unlike herpes, which is like the gift that keeps on giving. This one, you take care of it, you usually don't get it again, especially when your immune system responds to it.
Thank you guys for tuning in. Hopefully you found this video helpful.
Don't forget to like and subscribe.
We'll see you next time.